So before we get started, I would like to introduce myself and tell you a little bit about our fall programming. My name is Abby Horton, and I'm one of the wellness class educators for campus. Our schedule this fall, we have a number of health screenings and wellness classes that we're excited to tell you about and to offer you as part of your employee benefit. So we have health screenings listed here on the left-hand column and wellness classes on the right-hand column. I teach many of those classes, but we have some other wonderful partners and collaborators on campus that also pop in to join us and tell us about their specialty areas. And so we'd love for you to participate in wellbeing this year. And that includes a screening, a class, and a program. And I'm going to show you on the next slide some of the program opportunities that we have. We have Move Spring challenges. We have the Sleep More, Stress Less program, which will be coming out this fall. We have Strive for 5, and then other events like Quad in Motion, and then Even Better Bites, which kicks off tomorrow, actually. And so any of those programs, classes, or screenings that you can make, we'd love for you to sign up and participate. So cardiovascular health is important to our overall well-being. And, just to introduce myself to you, if you don't know me, I teach over in the College of Nursing. I'm a registered nurse. I'm a certified health and life coach. I'm a wellbeing ambassador for the Honors College and a wellness class educator for wellbeing. My contact information is here. It's Abby.Horton at ua.edu. And we'll have time at the end of the presentation for questions, but I would also love for you to reach out if you think of questions after the presentation ends, or maybe you have comments or feedback. We'd love to have those. So for the outcomes today, we'd really love for you to be able to identify healthy habits that are going to reduce your cardiovascular risk factors. We want you to understand the relationship between cholesterol and hypertension, which is high blood pressure. We'd love for you to learn the risk factors for the high cholesterol and hypertension that you may have or may develop. And we'd love for you to be able to identify some healthy habits to help reduce high cholesterol and high blood pressure. So when we talk about high blood pressure, we talk about hypertension, just know that because you have high blood pressure does not mean that you have a diagnosis of hypertension. And we sometimes will use those terms interchangeably, but you definitely can have a high blood pressure reading. For example, today, if you were driving into work in traffic and you had a near, accident and you had to slam on your brakes and you had a near miss with that situation, you're going to have high blood pressure most likely because you're going to react and have a stress response, but that doesn't mean you have hypertension. And so we do want to be really clear about the differences. Hypertension is going to be a sustained high blood pressure that you're going to have over a number of visits. Usually it takes 3 visits or 3 different readings at your primary care physician's office or practitioner's office to be able to be diagnosed with hypertension. And so we'll talk about that more as we move through the program. So cardiovascular health, when we think about that, we're not just talking about the heart, but we're also talking about the vessels. We're talking about, your veins, your arteries, and making sure that overall your inflammation and your heart health is in good condition. And so when we think about cardiovascular disease, we know that that impacts our high blood pressure, our high cholesterol, our tobacco use, and our risk for metabolic syndrome or even diabetes. And so lots of things that we can kind of dissect together today, but if at any point it gets too medical or you need further clarification, please feel free to drop a comment or question in the chat box and we'll be monitoring that throughout. So the American Heart Association has an awareness campaign, and we say a lot of times in healthcare, especially in nursing, you need to know your numbers. And when we say you need to know your numbers, we mean that you need to know all of those important lab values and metrics that we measure in a doctor's office or a wellbeing screening. So you need to know what your blood pressure normally runs. You need to know what your cholesterol numbers are, and not just your total cholesterol, but you need to be able to identify your HDL, your LDL, and know all of those triglyceride numbers that make up the whole health picture. You want to know your BMI and your weight. And we want to have you, really understand those numbers so that when there's a change in the numbers, you can actually, have an awareness of what that means for you. We want you to really own your lifestyle. We want you to realize your risk factors. We want you to be able to educate yourself and others. And we want you to not be silent. We want you to share the information that you've learned, because it's so important in creating awareness and starting to get a handle on our overall health. And so GO RED is the acronym that helps us remember the important points of the cardiovascular awareness that we need. So for cholesterol and hypertension, this is a graphic that I put in because I think it does a good job of explaining the importance of cholesterol and its impact and relationship with blood pressure. So oftentimes we talk about blood pressure as being, or hypertension as being a silent killer. You actually can see it here on the infographic that it says it's a silent killer because many people don't have symptoms. But what I would like to point out to you is that, in my opinion, having high cholesterol is more of the silent killer, because there truly are no symptoms with high cholesterol. But with high blood pressure, once you get to high blood pressure readings that are staying sustained, like I mentioned earlier, you're going to be having fatigue, you're going to be having maybe some muscle pain, you're going to be having headaches and brain fog. And so blood pressure that stays in those high levels that would be considered hypertension, you're going to have some symptoms. But initially, when the blood pressure raises, you might not. So cholesterol is really the silent killer, in my opinion, because cholesterol most likely is going to raise before your blood pressure raises. That's not true for everyone, but for most people, when we look at the numbers, your cholesterol is actually going to be elevated. And so what happens a lot of times is you go into the doctor's office and you're going in for a routine screening, or maybe you're going in because you're sick or some other reason, and they take your blood pressure, your height and your weight and all of those good things, and they say, oh, your blood pressure is high. Let's make a note of that. Does it normally run high? And, the patient will answer, and then they'll do some blood work. And so usually they'll probably draw, a number of tubes or vials for them to run tests. And oftentimes it includes a cholesterol reading. And so they'll see that your blood pressure is high, and then they'll often go and look at your cholesterol to see if it is high. And they'll say, oh, well, it just so happens that your cholesterol is also high. And so what that tells me is, even though sometimes we might feel like that's a surprise or a shock, it's really not all that surprising, because when cholesterol gets to a point that it's elevated and your body can no longer manage the excess cholesterol, then it starts to deposit that cholesterol in our vessels. So in our blood vessels, that cholesterol will go and deposit itself, and it will become a little plaque. And so that's what's being depicted here in this infographic. You see the yellow represents the cholesterol, and you see that it's blocking the blood flow. So if you think about our blood vessels as being like a water hose, if you have an old water hose that gets, kind of a kink or crimp in it, or maybe it gets, some erosion and things in there, maybe, it starts to rust, that can be very similar, to the way that the cholesterol will impact the blood flow through the vessel. Same thing with water through a water hose. If the water's not flowing freely, that it spits and sputters, and that pressure has to build up to be able to get past that block in the water hose. It's the same thing with our blood vessels with cholesterol. And so what happens is, when that cholesterol can't be used or absorbed or eliminated by the body, the excess goes to those vessels, and it causes blockages, and it raises our blood pressure. Now, there are other reasons why blood pressure can be raised that doesn't have to do with cholesterol, but this is a really common scenario. So you always want to make sure that you're getting your cholesterol read at your practitioner's office, and that you know what your blood pressure is, and that those are going to be two really important factors in terms of your cardiovascular health. And we'll walk through what we need to know about those factors. So cholesterol is naturally found in our bodies. It's naturally made by our bodies, and it's in the foods that we eat. And so it's important to note, we sometimes villainize cholesterol and say, oh, cholesterol is bad, quote unquote, and cholesterol is not bad. It's actually necessary. And so every cell in our body requires that we have cholesterol because cholesterol, a number of other hormones, are really central to the hormonal cascade that we need in our body. So cholesterol is needed for hormone synthesis, for vitamin D production, and for other normal body functions. And so when we look at cholesterol, we often say that HDL is the quote unquote healthy cholesterol, and that LDL is quote unquote the lousy cholesterol, so that we can remember which is good and which is bad. But I'd really like for us to change the narrative around that, because you need to have both LDL and HDL. And what we want to see is that there's a healthy relationship and ratio between the HDL that we have and the LDL that we have. What happens is that if we're consuming too much cholesterol in the form of the foods that we eat, so think highly processed foods, highly processed and packaged foods, they're going to have more trans fats. They're going to have more, things in them that are going to lead to having more of the LDL. And you've got to have a good ratio of HDL to be able to actually manage the LDL. And so I'm going to talk to y'all a little bit more about that in the upcoming slides. But then we also have red blood cells. And so when we look at the relationship, we need healthy red blood cells. We need a good ratio of HDL to LDL to be able to make our body function in the way that it was designed. So we don't want cholesterol to be so low that we can't heal our bodies, because cholesterol is needed in all of our cell function, and it's needed in repair, and it's needed to help with the healing process. Okay, so I hope y'all are still with me. Definitely put questions or comments in the box if you need to. So cholesterol is going to be that soft and fat-like waxy substance that's found in the bloodstream. It's very sticky, and so that's why we're concerned about it, because that's what really leads to those blood vessels being blocked when it's deposited there. So when cholesterol is in a normal quote-unquote range, and it's a healthy range, then it's a healthy aspect of our body and our health. So our liver actually makes cholesterol, and it's in the foods, like I mentioned, that we eat. So sometimes in meat and dairy products and other packaged and processed foods. And so when our liver makes cholesterol, that is okay. We want to make sure that we're not adding too much cholesterol that we actually consume in the foods that we eat. And so that's what we really want to limit or lower. So our body, again, it needs cholesterol to work properly, but it can raise your risk of cardiovascular or coronary artery disease if it becomes too elevated, particularly if it's elevated because of your diet, not because of your liver. So if you have an unhealthy liver, that can cause issues with your cholesterol, but most of us actually are just consuming too much of it in our diets. So HDL is considered high density lipoproteins, and LDL is considered low density lipoproteins. And then we have triglycerides. So when you're looking at your cholesterol number, a lot of times you just get the number that is the total cholesterol. What's important to know is what is the actual breakdown of your HDL, your LDL, and your triglycerides, because you can actually have an elevated total cholesterol, and it's because your HDL is high. And if your HDL is high, but your LDL and your triglycerides are low, then we're not as concerned that your total cholesterol is high, because it's high because you've got a lot of HDL on board, and that's a good thing. And I'll explain why in just a minute. So the function of HDL and LDL, I think of it as Pac-Man. Now, I was not of the generation that played Pac-Man originally, but I can remember seeing my older brother play Pac-Man and how cool that was. And if you remember, the little Pac-Man creature kind of gobbles up anything that's in its pathway. Well, that's really how HDL and LDL react in this situation. So you see that you've got the liver, and the liver is making this LDL, okay? And this LDL is carrying cholesterol to the cells. So it's getting in the bloodstream right here, and it's taking this, cholesterol, this LDL, into the bloodstream to do its job, okay? And you see that when we have too much LDL, it's getting deposited as a plaque in this blood vessel. So this is the artery or the blood vessel we're talking about. The HDL is like the Pac-Man that comes in and eats away or takes away the excess cholesterol or the excess LDL. So if you get too much LDL and you don't have enough HDL, and I think about them as being helpers instead of healthy, I remember this as HDL being helpers. They're the helper that kind of gobbles up the extra LDL and takes it back to the liver for the liver to recycle it. Okay. So the liver produces it originally, sends it out into the bloodstream to do its job, and then the HDL picks it back up. It's being the helper or the healthy LDL, and it's taking it back to the liver to be recycled. Okay. So what happens is if you don't have enough HDL on board, then you don't have enough helpers to get the excess cholesterol back, and it stays in the blood vessel or artery as a plaque. And that's when it becomes a problem, because this is kind of waxy and sticky, and it makes red blood cells clump together, which are what these little guys are right here. And it makes it difficult for the blood to go through, because now you've limited the size of the hose, the water hose, where we're getting that pressure issue. So I hope that makes sense. I see something in the chat, so I'm going to look. Okay. George, oh, I love it. Yes, you love playing Pac-Man as a kid. It looks pretty fun, I have to say. So I hope that that gives you kind of an idea of, LDL is not bad. It's just you need it to be in the right ratio, or it's not going to work because you don't have enough helpers. It's really easy to get more LDL because we consume it in our diet. It's not so easy to make more HDL, and that's where the challenge comes in, because when you need to raise your HDL and lower your LDL, that gets a little bit challenging for most of us. Okay, so we're going to move on to the next slide. So then we have to think about triglycerides. So triglycerides are a type of fat that's stored in the body, and it's the most common type of fat in your body. So when we think about eating things like butter and oils and other fats, you're really thinking about triglyceride load. So triglycerides are going to be something that gets stored when we have extra calories. So if you're eating good types of fat, I'm not saying to eliminate butter. Butter is always going to be better than a butter substitute. So always go with the real thing in moderation versus a low fat substitute, because low fat is going to have extra chemicals, trans fats, and it's going to be overly processed. It's probably going to have more chemicals in there because you're reducing the calories, but you've got to add flavor back in. So I would much rather you eat butter in moderation than to have like low fat margarine. So butter is actually going to be healthier, and there's research that backs that. So definitely fact check me, but it's not mainstream to say that. So you're going to still see recommendations for the low fat substitutes. Just know that it's not the best choice right now. So calories that you eat but that you don't use right away are going to get stored, and it's going to be that storage of triglycerides. And so when we get exposed to chemicals or things that our body can't process, what it does is our body actually acts to protect us, and it stores those chemicals or those things that we're exposed to, it stores it in our fat cells. So the more fat cells that we have, the more triglycerides that we have, the more that we're storing those chemicals and things that we're exposed to. And so a lot of times when you're losing weight, you feel better not only because of the gravitational, pull, you don't have as much weight that you're carrying around, but you also don't have as much of a toxic load because that's where toxins get stored. The triglycerides are going to really impact your overall health, and we need triglycerides and we need some fat storage because we need energy, and our bodies need to be able to eat, every day. But it also needs to be able to have fat reserves on board in case we get cold or in case we get stranded. We've got to have some of that on board. It's just a part of our survival mechanism. So again, triglycerides aren't bad. It's just we have to have a healthy ratio of those. So there are types of fats. There's unsaturated fats, there's saturated fats, and there's trans fats, okay? So unsaturated fats often are not listed on food labels, and saturated fats in the way that we talk about them. So you have to really look at your food label when you go to the grocery store. So saturated fats are going to be animal fats, and these are the fats that are going to trigger the liver to make excess cholesterol. So I'm not saying to do a totally plant-based diet unless that's something you choose to do. But when you eliminate some of those animal fats, particularly the ones that aren't lean, you're going to help your body and your liver specifically, because the excess cholesterol is not going to be there in the same, percentage that it's been there before. So the first step in lowering your cholesterol would be to reduce some of your animal fat intake. Your trans fats are going to be man-made or human-made preservatives. And so trans fats sound like fats, and it sounds like something that naturally occurs, but really it's a chemical process that is done in, our food laboratories and in manufacturing of processed foods. And so those also trigger our liver to make excess cholesterol. So we want to focus on unsaturated or healthy fats in our diet, and oftentimes these aren't all listed on our food label. So we have to do some investigative work to make sure that we're eating a healthy balance of fat. And fat is another thing that gets vilified today. Sometimes we say, fat is bad for you. But really, you need carbohydrates, you need healthy fats, and you need protein in your diet. Full fiber carbohydrate, healthy fat like avocado, some lean animal proteins, nut butters and seed butters that have fat. Those are all a part of a healthy diet, and particularly protein, because protein is going to help sustain your blood sugar and make sure that your blood sugar stays steady throughout the day. And so those are all considerations. You don't want to eliminate fat and you don't want to eliminate carbs. You just need to make smart choices about which you include in your diet. So triglyceride normal value range. So you've got this block here that talks about the normal range. So we really want to see that your triglyceride levels are less than 150 milligrams per deciliter. And when we get to the point that we're at the over 500 mark, those are very high. And so over 150, over the normal level, you're going to be at an increased risk for heart disease. And so we want to make sure that you also know that you're at risk for metabolic syndrome. And that is where you have increased inflammation, increased BMI. You also have a risk for diabetes and heart disease. And all of these things also put you at an increased risk for stroke. So we often think about stroke and heart attacks as being separate, but if you are at risk for one, you're at risk for the other because of the way that the inflammation, the blood vessels and all of that work. It's the same mechanism that you have when you have a heart attack as if you have a stroke. It's just that it impacted your brain first versus your heart. And so it's not uncommon to see that you have heart issues or that you have risk for stroke or TIAs, which are called transient ischemic attacks, or they're called mini strokes. You're at risk for both. So it's important that you think about brain health in this conversation too. But most of all of this goes back to inflammation and healthy lifestyle choices and healthy diet. And so we're going to talk about how we can combat some of these risk factors and really start to make progress on being healthy. So again, some of this is what we've already covered, but I wanted to give you this graphic because I think it's helpful. When you look at your ratio here, this is the formula for total cholesterol. So your total cholesterol is your LDL plus your HDL plus your triglycerides divided by 5. So that's how the total cholesterol number gets generated. And this is the number that you typically see. You don't often see the LDL, HDL, and triglycerides given to you, particularly when you're discussing them with your healthcare provider. But these are important to know because, again, if your HDL is high, it may be that your total cholesterol is high, but it's not as concerning because you really need those extra helpers. So think about that as you move forward, and definitely ask your provider when you go and get screened if you can have all of your numbers. That'll give you a better picture. So the downside of excess cholesterol, we've mentioned several things already, but again, it's that the bloodstream starts to accumulate with those, plaques or that buildup. And those plaques are considered, concerning because they can rupture. So if you've ever had, a zit or a pimple on your face, I'm sure we all have, and you know that it almost looks like a little, volcano, or a little, white head that gets on, or a black head that gets on your face, and it starts to make that volcano looking, zit on your face, and then it will sometimes, rupture, and that zit will pop. That's what happens to your plaque in your vessels. So once that accumulates so much that it builds up the pressure, it builds up the pressure of that blood that's coming, and it will actually rupture. And that's where you can have a heart attack, a stroke, or something like that, because it's essentially a clot that is forming in that vessel, and that can cause some occlusions and narrowing of your arteries. So it also makes them less flexible. So that can be problematic because your vessels then don't respond as well. So you can have the high cholesterol, the hypercholesterolemia. It's a difficult word to pronounce. And I don't always do the best job of that, but you can also have atherosclerosis, which is the narrowing of that artery. So you've got high cholesterol here, you've got atherosclerosis, that narrowing of the artery here, you've got heart disease, and then you can have heart attack and stroke. So again, it's important to note that your first signs and symptoms of this becoming an issue or a potential issue for you is that there aren't any symptoms. So knowing your numbers and staying up to date on that is really, really important. Okay, so with health concerns, I mentioned heart attack, stroke, but also poor blood circulation. So you can start to have neuropathy in your hands and feet and legs and limbs. Your blood pressure, again, it's going to fluctuate, and this can also impact your blood sugar and just your overall inflammation. So you may start to have inflammation or swelling, and it's not because of an accident or injury, it just is a sign that there may be something else going on cardiovascularly. I see a question. Will we be able to download the slides? Yes, please let us know if you'd like the slides, and we can have the wellbeing office send those to you. Absolutely, happy to share this. So you have the normal artery here, and you've got the red blood cells, and then you've got the initial stage of the atherosclerosis. So you can see that it's starting to build up a plaque of cholesterol, and then it's advanced, and then it's in its last stage. The thing that's important to note is that a complete blockage is not a complete 100% blockage. So a complete blockage from a medical perspective is going to be actually about 70 to 80% of that artery is blocked. So a complete blockage, we would expect that this all would be yellow and it's 100%, but a complete blockage for us medically is actually 70 to 80%. And that's important to note because at this level, you're going to start to have some chest pain and tightness, depending on where the blockage is. You might even be having headaches if it's a blockage that is above the heart and it's impacting the brain. So you're going to be really symptomatic, probably even, in the interim between beginning and advanced plaques, but you may not know why. Okay. So inflammation, I've mentioned it a few times. What happens with the cholesterol when the cholesterol elevates, and you get that extra cholesterol in the bloodstream because we don't have enough HDL, or we have too much LDL, or we have too much LDL and not enough HDL. We have both of the problems. What happens is that excess LDL starts to seep out of the artery, and it starts to cause this high blood pressure. Okay, and you can see that here in this image, the blockage there. So it triggers the inflammatory response because the blood cells that are interacting with this plaque note that there's something wrong, and it needs to send other helpers to the site to get this cleared up. So you're going to have inflammation. You'll have inflammation at the site, so there'll be a local inflammation. And then as this becomes a chronic problem, you're going to have chronic systemic, meaning all over inflammation. And so this turns into an issue where you may have swelling of your hands and feet and legs. You may start to feel lethargic or really tired, and you just don't feel great, but you may not know why. You also may start to have increased, markers in your blood, your SED rate or your C-reactive protein. Those may elevate because it's noting that there's inflammatory processes going on. It just doesn't know where. And so when we think about, these arteries being clogged, it's important to note some of the more common, but also some of the lesser common symptoms and warning signs. So, obviously you could have a heart attack or stroke, but you also can have fatigue and dizziness. You can have shortness of breath, chest pain, headaches, if it's more impacting your brain. You can have lower back pain, which is a lesser known reason and common, concern for people. You can even have erectile dysfunction, or you can have painful, numb, or cold hands and feet. And that's the neuropathy that I was talking about. So those are some common signs that you want to look for, but you may not have been aware of all of those. Okay, so blood pressure, we've mentioned it before, but just so that you can see a better representation, it's that, pressure or that force that's exerted by the blood in your arteries to get it to where it needs to go, whether it's being pumped back to the heart or whether it's being pumped from the heart out into the body. And so as that pressure in the arteries increases, with the heartbeat, then you have a resting period and it decreases while the heart's at rest. And so it's important that we maintain our blood pressure, because if we don't, we're going to be wearing out our hearts and we're going to be putting extra demand on our hearts to recover. And so as you see here, this represents the narrowing. So it's red, it's not yellow this time, but you see that it's narrowing. So this is an open or quote unquote normal vessel. This is where it starts to narrow and it's pre-hypertension. So, it's getting to the 120s over 80s and staying there. We like to see that your blood pressure is not just 120 over 80 now, but that it's less than 120 over 80. But we also need it to be, more or less greater than 100 over 60 or 70, because we don't want your blood pressure to be so low that you're really tired and you don't have energy. So everyone has a happy number, and you just have to really get to know your body and your blood pressure. Then we get to the narrowing part, and this is where we actually have hypertension, because your blood pressure is being sustained at a high level because it's having to really exert a lot of pressure and force to get through this narrow opening here. And this is another way of looking at that, just another image. And so you've got your systolic pressure and your diastolic pressure. And so your systolic pressure is measured between the heart contractions. And then the diastolic pressure is between the beats when the heart relaxes. And so we actually get more concerned about the diastolic pressure, which is typically going to be the lower number, because when the lower number gets to be really high, it means that your heart isn't getting the rest that it needs to be able to pump the blood to and from. And so the diastolic number is actually a little more concerning, and we don't always talk about that because we know that the heart's not getting the rest that it needs. Okay. Everybody still with me? Put your questions in the Q&A or the chat if you'd like. I want to make sure y'all are hanging in there. The thing that's important, this is more of a medical version of the presentation, because I think it helps for you to understand the why all of this is important, versus just coming in and me telling you these are the things that you should try to do to maintain heart health. Because when you understand why things are not working well, you can make changes that maybe I wouldn't even know that you need to make personally. So that's why I want you to feel really empowered with this information. So less than 120 over 80, that's a newer recommendation. When the Heart Association came out with their latest recommendations a couple of years ago, they said, you know what, we really want your blood pressure to not even be 120 over 80, which has always been the norm. We really want it to be a little lower. So these are the categories of blood pressure. And again, when you're in stage 2 or you're in hypertensive crisis, you're getting into the stroke level ranges of blood pressure. And it's really easy to get there without realizing it. I had high blood pressure diagnosed, it's been 3 years ago this fall. And, I attributed it to a stressful time of transition in my life as a graduate student and, transitions in work responsibilities. And, I was having some more headaches and I was going to the doctor and getting all of my lab values and things. And then suddenly, I was in the 180s over 100s for blood pressure and didn't have a lot of other signs. But then, of course, when I had my blood work done, my cholesterol, which had always been really normal, was suddenly high. And it didn't take very long for the blood pressures to go from normal ranges to, hypertensive crisis level, and for my cholesterol to go from normal ranges to go to elevated. So, you can have a really quick change with this. It doesn't have to be a gradual change, which is what we usually think about. I'm happy to report that my numbers are great now, but it's important for you to understand the change can be pretty rapid. These are other ways of looking at your blood pressure. I think it's good for you to actually, be able to see things in multiple ways because we all learn differently. But, when your normal blood pressure range is in the, normal range, it's staying there. Maybe you have some elevations from time to time. That's typical of our life. You're just doing lifestyle choices and yearly checks to keep your blood pressure normal. But when you're in the elevated range, you're starting to make some changes and you're reassessing on a more frequent basis. So 3 to 6 months. High blood pressure, you're stage 1, you're really looking at doing heart and stroke assessments for those risk factors, and you're making more changes. You're probably on blood pressure medication at this point, and you're reassessing every 3 to 6 months, if not more frequently. When you're in stage 2, again, you may be taking more than one medication, and you may be having more frequent, even monthly follow-ups with your care provider, and making sure that your blood pressure is well controlled. So some other hypertension symptoms that you can see, more that I didn't include on the other images, you can have irregular heartbeat, you can have flushing and nosebleeds, a pounding in your chest, but also in your neck and your ears, visual changes, you can have blood in the urine, and your confusion can even, kind of coexist with that fatigue or brain fog. So those are some other symptoms to take note of. Okay, so I mentioned this with the diagnostic criteria. Blood pressure is going to fluctuate every day. I can tell you my blood pressure has fluctuated today. It's been a busy day, but you are going to have those 3 or more hypertensive readings that are required for a diagnosis in your doctor's office or nurse practitioner. Either one can diagnose. What I want to point out here, though, is if you're only going for an annual exam, it could take years for them to diagnose you with hypertension if you're not going and following up with symptoms that you're having. And so it's really important that if you're having symptoms that I've mentioned, or if you've had a high, reading, that you're following up more frequently than just your annual visits, because you don't want to delay your treatment. Whether that's lifestyle changes or whether that's medication, the quicker that you can start to, work towards solutions, the more likely you are to have a good outcome with this. So early detection is key. So some health effects of high blood pressure, again, it's going to be all of the things that we've talked about before, but just know that it can also impact your kidneys and definitely blurred vision, which a lot of us have some vision changes now that we spend so much time on the computer. Particularly, we've done a lot of Zooming this past year. And so make sure that what you're experiencing is not just, eye strain, but maybe there are other things that you need to investigate. So having a good yearly eye exam where you have a pupil dilation and you're actually looking at your eye pressures to make sure that you're not having any issues there is important. And of course, the others that I mentioned here. So we have about 75 million Americans who have high blood pressure. That's about 1 in 3 adults. And about 1 in 3 adults also are at risk for prehypertension. So, only half, about 54% of people with high blood pressure readings are considered to be well controlled. And that was with medication or without medication. And so we know that this is a huge issue in our country and something that we need to be more educated about. So risk factors that are important to note: stress is going to always be the number one that I mentioned because it's something you can control. Smoking, substance use, obesity, diabetes, your salt intake, overly processed food, caffeine consumption is a big one because we all usually consume a lot of caffeine. And then things that you can't change would be your family history and genetics, your ethnicity, more so to do with your genetics and your environmental exposures, your age, and of course, your sex due to hormones. So it's really about your hormones in that sense. And as you increase with, your years, as your age increases, you're going to be more at risk because you've had more exposures and more stress and more wear and tear on your body. So treatment, you can have things like diuretics, ACE inhibitors, beta blockers, calcium channel blockers, and the like. It's just so important that you know that there are treatment options out there, but we hope to be able to make lifestyle changes that will help you not need these medications in the future. But they are great when you need them, and it doesn't mean that when you start a medication that you have to be on them for life. I started 2 medications when I had my, kind of run of high blood pressure, and I've been able to wean off of those as I was able to get other lifestyle things in check. And so that's great. It doesn't mean that you have to be on a medication forever. It just might mean that in the interim, to get your risk factors down, to get your blood pressure down, you might need intervention. So diabetes is an important part of the conversation because many people who have high cholesterol and who have high blood pressure are also going to have high blood sugar. And all of those things together will, really result in what's called metabolic syndrome, where you have those 3 together, and it's all at the basis of inflammation. So if you can work to get your inflammation down, that's going to be the biggest helper in terms of getting your lifestyle on track. So this is really a toolkit for you to use, 7 steps to a healthier heart. And it talks about how you can watch your cholesterol, your blood sugar, how you can get active, change your diet, and then monitor your weight, your BMI, your blood pressure, knowing your numbers, and then really limiting or eliminating your tobacco use are going to be really important steps in maintaining a healthy heart. So some general tips that I like to share with people: sleeping well, staying hydrated, drinking about half of your body weight in ounces a day. So if you weigh 200 pounds, drinking 100 ounces of water, that's a good recommendation. The 8 glasses of 8 ounces of water would put you at 64, and that's not enough water for most people. But you don't really want to be drinking more than about 128 ounces or a gallon of water a day because you don't want to overhydrate and you don't want to cause issues of water toxicity. You want to strive for a healthy plate. So eating more plant-based foods, about half of your plate being vegetables, is important. And eating the rainbow of vegetables is really important because those are going to represent the different colors, are going to represent different antioxidants and minerals and vitamins and things that you need in your diet. So if you're missing a color, you're missing some key nutrients. Moving your body every day, and that doesn't have to be a huge cardio workout or a HIIT or CrossFit or fancy gym membership, but moving your body for at least 30 minutes every day is super important. And then meditating 3 to 5 minutes a day. And that could be, an app, that could be just listening to some calming music for a few minutes, but really taking a break for your brain. For me, meditation is for the mind or the brain what sleep is for the body. When we sleep at night, we often talk about, get 7 to 8 hours of sleep at night or 7 to 9 hours of sleep. But the quality of sleep is as important as the number or the quantity of hours. And so when you sleep at night, your body is repairing itself. But if you're not staying in tune with your circadian rhythm and getting in bed by 10 and setting yourself up for a good night's sleep, then you're not getting the good restorative sleep that you need. And a lot of that restorative sleep happens between 10 p.m. and midnight. And so many people aren't getting that good sleep in that time frame. So sleeping in extra hours is not going to help that because you really need to be in bed and asleep at 10. Blue light exposure, limiting that after 9. There's lots of great things that you can do to promote better sleep. And these are some things that I have put together, just a handful of tips for each of those 5 wellness basics that I like to cover with y'all. So 7 to 8 hours nightly, be in bed by 10, try to be asleep by 10, have an evening routine. So all of those things that we know to do for young children, like putting pajamas on and kind of powering down the night, making it dark in the rooms, maybe having something warm to drink, maybe taking a warm shower. Those are all things that we need too. We're just older kids ourselves and we could really benefit. I mentioned no blue light after 9, or at least have some blue light blocking glasses. They have some great ones on Amazon for just a few dollars. And keeping your room cool, dark, and quiet is really helpful. This will also help your stress. If you don't sleep well at night, you probably notice that you're not as patient or as happy the next day. So good sleep is important. Hydration, really track your goals and your progress with water, because this is going to fluctuate. I have a really busy day today, and so I'm doing a lot of talking, and I know I'm going to need to drink more water today than I will tomorrow, where I have more office work and I'm not talking to as many people. The more that we talk, the faster that we breathe, the more that we're doing those respirations, and we're losing water when we're talking and breathing. And so that's so important to know, because I might need 100 ounces of water today, but I might only need like 70 or 80 tomorrow. But tracking your activity and how much you're drinking and how you feel is going to help you know that for yourself. Carry your water bottle with you everywhere you go, and make drinking water fun. You can add flavors to it, herbs and fruits. You can get carbonated water if it doesn't have extra additives in there. Lots of fun things to do to make water fun. I mentioned eating the rainbow. We often think about healthy food as being green, but really we need the reds, the yellows, the blues, the purples. We oftentimes eat a lot of beige and brown food, and then some green food when we're feeling like we need a salad or something to feel a little healthier. But, having more color on our plate is going to be better. And that half of that plate needs to be fruits and vegetables, but mainly vegetables. You want to include a protein, a complex carbohydrate, and a healthy fat at every meal, because that's going to help sustain your blood sugar. Every meal and every snack, that's really important. And you want to track what you're eating, because if you notice that the scale jumps up the next day, if you weigh daily, that's a really helpful, metric to know that data. If you have a healthy relationship with the scale, it's good to know, because if you gain 2 or 3 or 4 pounds overnight after eating something, then you know that that's probably not the best choice for you, and you can make adjustments. So tracking that can be really helpful for you. And I just encourage you to make one change at a time, because you really could get overwhelmed with all of the information I've shared with you today and some of the solutions I've shared. So I always encourage people to start with one thing. And I usually recommend drinking water first, because water is what you have the most control over, and it's probably going to be the thing that helps you feel the best. You can do everything right in terms of your sleep, and you don't have as much control over your sleep outcomes as you do your water intake, because you have more control over that. So you can do all the things and get in bed by 10, but that doesn't mean your body's going to go to sleep. But you can know that you drank enough water and that you tracked it. So just want to mention the DASH diet. The DASH diet is one that's used to help with hypertension. So it actually stands for Dietary Approaches to Stop Hypertension. What I want to mention there is that sometimes they really recommend fat-free or low-fat dairy products, or seasonings that have a lot of processed, and additives in their ingredients. And so I would say, again, the real thing is better in moderation. So if you're going to, have a soft drink, in my humble opinion, a regular Coke is better than a Diet Coke, because of all of the aspartame and extra chemicals in the diet drinks, because your body can't recognize that, a Diet Coke, even though the calories don't get counted the same, it doesn't recognize that you have this substitute there. It still counts as a sugar, but your body is designed to handle and process sugar. It's not designed to handle and process those chemicals. And so you have the same reaction in essence to the fat-free and low-fat and low-sugar ingredients, but your body isn't able to actually do anything with that. So I think having, a moderate portion of real butter, real fat, a real Coke, if you're trying to give those up, would be better for you in the long run. And having that with a meal. So if you have a Coke, if you need to drink a Coke, drink it with your food. So eliminate the ones where you're just going through the drive-through to get a drink. I know I do that still sometimes. It's a treat, but make sure that you're eating something with it, because it's not going to alter your blood sugar in the same way if you were doing that by itself. Okay. So DASH diet is great, but my caveat is the fat-free and low fat. I'd rather see you, eat the full fat and just reduce it. And then be careful with your spices and things like that. Spice blends are going to be where you usually see the additives. And so you can use just one spice and make your own blends. That would be better. I see a question. A healthy fat. Absolutely, George. So a healthy fat is going to be like nut butter, seed butter, if you're not allergic, obviously, but like peanut butter, some forms of, almond butter, something like Nutella, but, making sure that you have a really clean version of that. Those are like the hazelnut spread. Those are going to be some good fats. And then your low protein, lean protein meats and animal fats would be considered healthy or good fats. Butter is a healthy fat. So butter is one of my favorites because it's going to really help with your skin and your complexion. It's going to be something that you can easily add into your diet and shouldn't cause you any problems if you're watching the rest of your intake. So nutrition facts. So trans fat, this is the chemical preservative load. So in this, nutrition facts panel, and I don't even remember what I pulled this from, which this was like a cookie or a cracker, I think. A trans fat, it's going to have 2.5 grams of human-made preservative in it. And so you really want trans fats to be 0. Saturated fats are listed here, and you have to know that formula that I shared earlier to figure out how many unsaturated fats. So the saturated fats and the trans fats are the ones that you want to really have be, as low to or as close to 0 as you can, because that's what's going to really impact your triglycerides negatively. Okay, let's see. We've got another question. What's your take on food items labeled low carb? I would say to steer clear of low carb foods, because low carb is going to have those extra sugars and chemicals to make it taste good, because carbs taste good and we need carbs. Carbohydrates, especially if they have full fiber carbohydrates, it's called FFC. Those are going to be the ones that really help you and your gut health with making your neurotransmitters. So those feel-good hormones that you need for your brain to work. And, if we starve ourselves of carbohydrates, the reason we're so hangry and moody and not happy when we're on a low carb diet is because our body needs them. And so that's our way of saying, feed me some good carbs. That doesn't mean go eat a donut, but that means go and eat something that maybe a whole grain, piece of toast with some butter on it. That would be a good carbohydrate for you and have fiber in it. So that would be my recommendation. Anytime we're saying low or no in a food and we're altering it, it's probably not the best choice. And we definitely need carbs. So this is another example of how to understand a food label. I just wanted to leave this here for you because, we don't spend enough time teaching people how to read a nutrition facts panel. Quite honestly, in our diet culture in the US, we just tell people to look at the calories and move on. And that's not really what we need to be doing. We need to look at our dietary fiber, how many sugars are added, how much protein we have, and then looking to see what it's fortified with, because many people can't process and tolerate synthetic folic acid. They really need folate, not folic acid. And so a lot of times people will think that they're gluten sensitive, and it's really that they're sensitive to some of the enriched flours that we have today. So it's always better to eat the nutrient or vitamin versus consuming it in an enriched product, meaning that it's been added to it unnaturally, or taking a supplement, although those can be really good for you too if you can't get it in your diet. So these are some things to try, some things to eliminate. So turmeric or turmeric, however you like to pronounce it, omega-3s, fibers, plant-based options, and healthy fats are going to help get your heart health in good condition. But limiting sugar and refined carbs, the refined carbs are going to be those donuts I mentioned, limiting alcohol, meat consumption, processed and fried foods, and avoiding trans fats are going to be really great for you. You also want to move your body every day, at least 30 minutes. These are some of my favorites. And I know that we're coming up on our time, but I will stay if y'all will stay. So yoga, Pilates, walking, swimming, Tai Chi, these are all great ways to move your body, but are going to be lower impact. Exercise is important. Cardiovascular exercise, we call it cardio, but it's actually cardiovascular exercise. So anytime you do cardio, having your heart rate sustained at 1.5 to 1.8 times your resting heart rate is going to be good for strengthening your heart. Your heart's just a fancy muscle. HIIT workouts are really good, but they're not good for everyone, especially a beginner. So if you're beginning an exercise program, start with walking or swimming or something that's going to be low impact, and build up to high intensity interval training workouts or HIIT workouts. Know that your body mass index is not the end all be all. Y'all, there are a lot of issues with the BMI, but just know that generally speaking, if you can lose about 10% of your body weight, if you're overweight, you're going to see a significant improvement in your overall cardiovascular health. And this is another example of looking at the ranges. Again, these ranges are based on one population subset, so it does not apply to all bodies. But it's used broadly for all bodies. And so just know that, you can be a healthy, healthy weight, a healthy size, and not be in range with the BMI, but it is a good way for us to kind of have a metric and a goal to set. So use it as a guideline. Meditation is really important. These are some of the apps that I like. Calm and Headspace and My Life are all great ones to choose from. But quiet time, relaxing music, yoga nidra, affirmations are all good ways to get in some meditation. We know that stress has an important part and effect on the body. And so I included that here. But all of that to say is get to the root cause of your stress. Don't just band-aid your stress. We talk about self-care, and self-care is more than just, bath bombs and chocolate. So make sure that you're getting to the root cause of your stress, because if you're constantly band-aiding it with self-care, you're going to still have that physical and mental impact of this stress. And of course, as we wrap up, smoking, vaping, tobacco use is going to act on the integrity of our arterial walls and our vessels. And so if we're smoking, if we're using tobacco, our oxygenated blood is going to be reduced. We're going to have poor health outcomes because of that low oxygen. And also our arteries are not going to be as structurally sound. And that's going to be a problem when we have that plaque buildup. Okay. So we would love for you to follow us on our social media channels. Ashley Bowman does a wonderful job of managing those. We have some blog articles that relate to the classes I teach, and then great information on the website, Facebook, and Instagram. And this will be archived on our website for you to go back and visit. And then these are some of the ways that you can get in contact with us. You can email me, or you can visit wellness.ua.edu for more information. So at this time, I would love to take questions or feedback. I know we're at our time exactly at 1, but if you have questions, I have the time to answer those. You mentioned the low number of blood pressure is high, then the heart does not rest enough. But what if the number of blood pressure is high? With the high number? So the high number, it means that it's just working extra hard while it's supposed to be working. The low number means that you're working hard when you're supposed to be resting. The high number means that you're working hard when you're supposed to be working. So it's still not good, but it's not as concerning as when it's supposed to be at rest. Hopefully that helped answer your question. Any other questions, comments, or feedback? We'd love to hear from you. Thank you, Wendy. I'm glad it was a good session for you. Thanks, Lorraine. Yes, we always appreciate your feedback and your comments. We want to make sure this is a meaningful experience for y'all. Got another comment in the question and answer that it was great. Thank you. Good, I'm glad. Thanks, Cynthia. Thanks, Kiana. Good. I'm so glad. Well, y'all, if there's ever anything that I can do for you, questions that I can answer, we'd love for you to reach out. I'm happy to help in any way that I can. This was a really content heavy session today, so I know it was a lot to consume, but really focus on those 5 wellness basics: your sleep, your hydration, you're eating the rainbow, you're moving your body every day, and your meditation. Just pick one and go from there, and I think you'll really start to see some changes. Add that to knowing your numbers, and you're going to be well on your way to good heart health. So reach out if you need anything. Otherwise, I hope you'll have a great rest of your day. Thanks for hanging in to the end. Bye, everybody.